Welcome to weeks 14 and 15. We will discuss the model for improvement in the next 2 weeks. During this course, you have identified a patient problem, practice issue, or population health need, and developed an intervention to address it. You have learned that whatever problem you identified, developing a single intervention may not fully address the problem. You may have selected the best of the solutions you explored. You found research that supports your proposal. During your literature review, you may have found other potential interventions. In your practice setting, your solution may be the single best one. However, healthcare problems are complex and multifaceted, and in many cases, one single intervention may not completely address the problem or sustain the change. You may have a short-term and long-term solution, or you may solve the problem in one department or with one patient group, and then there is need to spread the success. There is a need for a framework to strategically proceed in process improvement. The model for improvement comes into the improvement process after you have completed your assessments, selected a theme, and developed an aim. The last several weeks have set the stage for upcoming weeks. As a practicing, doctorally prepared nurse, you will lead many projects. You may propose a new practice or solution to a problem, and you may receive full support or pushback. You may proceed smoothly, or you may revise your intervention, or you may even have to go to Plan B. So how can you keep organized and moving forward during your project? The model for improvement is a framework that can be used for testing improvement ideas. The model for improvement can be traced back to the statistics expert Walter Shewhart in the 1920s. He introduced the concept of plan, do, and see. The Shewhart cycle, combined with management thinking and statistical analysis, led to this model. Then Edward Deming modified the Shewhart cycle as Plan, Do, Study, Act, and this is known as the PDSA cycle. The PDSA cycle has two parts. First part is the questions to focus your improvement work, and the next part is the tests of change. This slide goes over the questions that need to be clarified. And these questions are what you have been working on for your project through the semester. Before beginning, you need to clarify, what are you trying to accomplish? How will you know when the change is an improvement? And then changes, what changes can we make that will result in an improvement? This diagram is a great illustration for the model of improvement and captures how the questions play into the PDSA cycle. The changes that are tested uses 4 steps: plan, do, study, act. And this figure captures in a very succinct way all 4 phases. We begin in the right upper portion, and this is the beginning for all projects using this framework, is that we start in the planning phase. In the plan phase, you describe the aim for the project and the change to be tested. In this phase, for example, education and training is developed and done. The plan is designed here. We ask the questions of what is expected to happen and who will collect the data. We identify the key players and the doers of the new proposed plan. In the next phase, this is the do phase, and this is when the pilot or phase, the introductory period. It is essential to have an identified team member to oversee the project and collect the data and the information about the tests of change. This will further inform the PDSA cycle. In the study phase, we analyze the data, we reflect on the results, and relay the analysis to the team and other stakeholders. It is important to compare the actual results with what you thought the proposed results would be in the planning phase. And then lastly, the act phase occurs when the team determines whether the data should be modified or abandoned or another intervention implemented. In this phase, the leader of the team takes what has been learned to improve the test of change. The project is adjusted, dropped, or expanded. It is at this point that the next PDSA cycle will begin. I've included here a worksheet. This PDSA worksheet will help with the design of your project. Many of these are available either at your organization, your clinic setting, or even online. This will help organize before you proceed, and it is to be used throughout the project implementation. Many times you will have a single sheet for each cycle. You may have a whole binder that includes all the cycles of change, or have these recorded in a file and kept online. This will include all the phases in the PDSA cycle. And this is another more simplified version that's available as well. I'm involved with many projects in my current role at my healthcare organization. Using the PDSA method has provided me with an opportunity to trial, pause, and learn. For the past 9 years, I have led Falls Initiative at my organization. By applying the Plan, Do, Study, Act steps, I have learned what interventions have been effective and which have not had very much impact. So we will look a little bit in a very broad overview of how you can use this model for improvement in practice. And I will apply it to one of the projects, as I said, that I'm involved with, so Patient Falls. So as we apply the PDSA cycle to Falls, one of the cycles of change that I added was hourly rounding. So as we go through the PDSA cycle, in the planning phase we asked who was going to carry out this pilot of hourly rounding. It was identified that the Med-Surg units and critical care would begin hourly rounding, and this began in the fall of 2015. Next was the Do phase. This was the part where we had task force development, staff were educated, and there were discussions around the detail. We identified who was going to do the collection, who was going to complete the data logs, and we were going to roll out the application of the hourly rounding process during the Do phase. In the study phase, we looked at both the process measures and the outcome measures. So in this phase, we collected the rounding logs, we looked at the completion, we captured where there were barriers or incomplete logs, and again, this addressed the process measures of the rounding itself. Then we looked at the outcome measures, and this was the falls rate. So after implementation in fall, we looked at both quarter 4 as well as quarter 1 of 2016 to see if there was an impact on the falls rate. Now in the acting phase is where we were going to determine whether there was changes that needed to be made to either the process of rounding, the logs themselves, follow up with staff, if education needed to be reinforced. And then as we would decide now here on any sort of changes, we would then begin again with the plan phase, and that would be the next cycle that we would be introducing. Now for example, if rounding didn't seem to have an impact at all, would we continue rounding for additional cycles with some modifications, or would we introduce another intervention? So for example, bed alarms at the bedside. So this gives a very high level of how implementing the PDSA cycle in a setting has had some benefit. Going on now to the next slide and looking at a run chart. And in your readings this week, you will read about various charts. And this is how we apply the PDSA cycle and learnings to a run chart. This data has now a visible display. It gives us a visual of whether the interventions are being successful. At times, you might want your intervention to have a reduction, and in falls, that would be the aim. In other cases, your project, you may want to watch for an increase. What you don't want to see is a flat line. If you see a flat line on a run chart, it is evidence that there has been no impact on the data due to your intervention. The various PDA cycles will be displayed on a run chart. A run chart is a graphical display that shows the trends in the measure of interest and reveals whether there is any change over time. And this is the most common type of trend chart that you will see in practice. So that concludes our presentation for these 2 weeks. Good luck in your readings, and continue to work on your final paper. And as always, Colleen and I are available if you have any questions. Thank you.